what I like about this is there's a community aspect to this, and the focus on health systems, even if you look at PPEs, probably not the place I might prioritize, right? I might prioritize places that have the highest cases because they're not necessarily related to health system, but they are the physicians in those communities or the workers in those communities who have needs, who may not have access to solutions or a place to go. So there's a bit here of how do you engage those to know you exist and that you're a source for them at a price point that allows them to be able to manage it within their communities. This is less about how do you stockpile, but really how do you allow yourselves to know, collect that initial data of the needs of a community and be able to then provide those health solutions that they may need. PPEs are one of them, but 3 months from now, it's flu vaccines. And so how do you understand kind of within this environment what the needs are and have that data-driven strategy to allow you to have your business survive, but also have an impact on the care that you're looking to do with a way of always including others in it. How do we ensure we have a system that rapidly allows experts to share information and then be able to find treatments for patients? And for many of you, you're aware of our transplant system, which has a lot of holes in it. For hematologists, they really don't have a place where they can go share this information in a secure manner and then be able to leverage services that they may need. So really, really loved these pieces. I also thought it was very thoughtful in acknowledging all of the boxes that have to be checked for this to be successful. It's not just personal genetic information that's being shared, it's personal health information. There's a huge privacy security component of this that you really need to have healthcare professionals buy into. Acknowledging that up front, I think really speaks to how you will have an impact because it is the first question that will be asked. We all acknowledge that accessible healthcare is healthcare. And the ability to introduce solutions into the ecosystem that improves access is really what this is all about. And it's what we all strive for. And I think any time you see a young company really focus on that and not only say we can do it in our technology, but we understand enough that there's a global need. It says that this work is team-based, right? It requires clinicians, it requires communities, it requires technology platforms, and then together having that strategy in place to allow us to achieve these goals. I really liked the comment by Sean of just the ability for this group to utilize their mentors. It speaks to a lot of how businesses succeed. It's how do you use expertise? I think Jose has been sharing a lot of that on this call today, of how do you use experts to help you not always restart at the bottom, but you're really taking a huge leap and building upon what came before you. And I think that was very noticeable with this group. So congratulations again.